So nearly more than 30-40% of the patient at last they need a palliative care. And if I can say, at my institute, we as a team of oncology, like we medical oncologists and the radiation oncologist, both the colleagues, we see nearly 25 to 30% of the patient who comes metastatic to us, that the cancer has already been spread. So there are two main differences from the initial stages and the fourth stages. Like in the initial stages, we go ahead with curative therapy, means we tell the patient that we will give you the most aggressive treatment that we can give according to the stage of the disease, and toxicity we will bear. You will, and you and we together, we will bear. We talk with the patient, okay, we'll be worrying for the toxicity, but not at the cost of curing the disease. But when we go for palliative treatment, like a patient has come to a fourth stage, then we don't go for, when we are not targeting for cure, we want the patient to live happily for the rest of his life, whatever is remaining. So at that time, the taking care of toxicity becomes very important. We don't want, like if a patient comes to us, I have a cancer and report is saying it has spread to this, now what is your opinion? Then we don't want he has came to us walking and we give him very good, as per se, very good chemotherapy and he develops toxicity and he is on bed. We don't want that. We want how much problem we can solve, we solve, but we don't give any problem due to treatment. So that is two important, very important differences. Cure is not an option. Cure is the option is manage or palliation, and we don't want any iatrogenic side effects. If we want to reduce the doses, we can reduce the doses slightly, but we don't want side effects. So these are the very important. And in the end stages of life, the you can say psychologist consultation is very important, because some of them are saying, he said, doctor, if there is no chance of cure, why should I get treated? Yeah, depression is very common. And if you see, depression in itself has been shown to be a poor prognostic. Like two patients with same stages, one has a depression and one has not, then the person with depression, he will do bad in comparison to person who do not have depression. So psychological consultation, the diet, and then palliation in itself is very important. If you see, there are many courses, like for one of the very important aspect is pain. Like if you can control the pain of a patient, sometimes I have seen patient who can say, doctor साहब कुछ भी करिए आप, बस मुझे दर्द नहीं होना चाहिए. So they are very afraid of pain, because in the last stages the cancer pain is very troublesome. It keeps on going. It doesn't stop anytime. So these all are aspects, and the one more important thing for palliation is that the patient needs to trust you. Actually, he needs to trust you for all this, but he needs to trust you. Whether my doctor is doing this or that, I need to follow, and that will be my benefit. That will benefit me.
Right, doctor. That is exactly that trust, the belief that you have that the doctor, only then the treatment will take its course on the person's body, I feel.
Definitely. If your patient trusts you, then I have seen that patient who have a trust, they do better. And they, like if we say, okay, you go ahead with that, like first chemotherapy is given, or radiation 2 fraction, 4 fraction has been given, and you say, just pain is there, and you suggest we need 10 radiation for pain. He said, okay, doctor, and 2, 3, 4 happens, and he said, doctor, it is not responding. Then at that time, he should not leave the treatment. You need to complete that 10 fraction of radiation. And sometimes what happens is that for pain, you give radiation and it responds after all the treatment has been completed, and after 2 weeks it responds. So that trust, he should not leave the treatment in between. Like if a medical oncologist is giving chemo and the patient is having pain and lot of fluid in the abdomen, and just after one chemotherapy, he runs away. Chemotherapy liya tha and it is not responding, he ran away. Then at that time, the trust came into play. For one time, doctor has suggested me 5 cycles or 6 cycles or 4 cycles, whatever. I need to take that, and then I will decide whether I have to go further or not. That at that time, the treatment break, it is very less when the patient trusts the doctor.